My name's Tory Alexander. I'm Clinical Lead Prosthetist here at Dorset Orthopaedic in Ringwood, and I also service the Cardiff and Bristol satellite clinics. Early rehabilitation is so important from both a physical and a psychological point of view for our patients. Getting them back up and active as early as we possibly can has a much greater impact on their long-term rehabilitation goals. The longer patients are left in a wheelchair without a prosthetic or orthotic device, the longer their kind of body is deteriorating and those kind of those downsides of long-term immobility are creeping in. Also from a psychological point of view, they're not happy when they're in a wheelchair, they're not able to get up and around and do the activities and be as independent as they can be. So getting them up, getting them fitted with a device really early and reducing the barriers to that are really important. If we can identify the patient's rehabilitation needs as early as possible, it gives us, it allows us to start earlier, and B, it gives a really good pathway for the supporting legal teams to understand what costs might be involved so that they can prepare for the funders. If rehabilitation is delayed, then we see lots of the downsides of long-term immobility creeping in, and it takes much longer for that patient to rehab. So the earlier we can get involved, the earlier we can start rehabilitation, and the better the patient's outcomes are going to be. So by running a free of charge complementary rehab assessment, it allows us to identify both the patient's kind of immediate needs and their long-term needs as early as we possibly can. There's no barrier to entry for the legal teams to get their patients into us, and that means that there's no requirement for them to seek funding. They can get here really, really quickly. If we can identify those patients' needs as early as possible, then we can address them before they get any worse, and we can really get the patient up and going as quickly as we possibly can.